So sometimes our patients have an acute deterioration in their status, and perhaps we're using a 6-lead telepack on the patient. So I have the electrode placed here in accordance with one particular manufacturer's guidelines of where they would recommend their lead placements for a telepack. So imagine you're taking care of the patient wearing this pack in bed. They ring the bell, they say they're having some acute onset of chest pain, and the monitor room is calling you, or one of your colleagues tells you that they see on the monitor that they've had an acute change in rhythm. So now what we have to do is anticipate that we're going to have to place them on a monitor that's on our code card. Now for the purpose of this, I'm going to show the LifePak. I have two models of the LifePak. I have a LifePak 12 and I have a LifePak 20E. So what's important to recognize about these are the keys that we need to use, and I'm not going to use them in the AED mode, is we need to know, are we going to shock this patient, sync Cardiovert this patient, or pace this patient? So I'm going to ask my trusted cameraman to move in a little bit so I can show you maybe a little more close up of how this monitor works. So always what's important is that you see the on button, okay? Turn it on. And I always say in the hospital, we work off of this side of the monitor. So you should notice that there is a gray box here and a green box down here, and there's one button in between. So if the gray box here you see has that thunderbolt, that lightning bolt there, that means these are the shock buttons. So if we need to shock a patient, you're going to turn on the energy, select your energy. You're going to toggle up or down on one side or the other. Then you're going to charge, and then you're going to shock the patient by pushing the red button. We're going to review that in a separate video. The next step, what we can do with this monitor, is pace the patient. Again, similar to this button, the gray box up here, you start at the top of the box and move down. So we turn it on, select your energy, charge it, and shock the patient. If we need to pace the patient, you're going to turn on the pacer. Now, I don't have the patient connected to electrodes, but the technology always works the same. Start at the top, select the rate, select the current, and then this button is to pause it if you're looking for the native beat. So within the boxes themselves, you start at the top and move down. I'm going to turn off the pacer. The only other button is the sync button in the middle. That's your synchronized cardioversion button. When you need to sync a patient that you're going to cardiovert them, just like the buttons up here, press the sync button, select the energy. You're going to use less joules on your cardioversion. Select your energy, charge, and then deploy the energy. Now, if we have a patient here on the 6-lead telepack, and for whatever reason we would need to connect them to a monitor, what we're going to have to do, again, I'm using a specific pad from a manufacturer. You will always follow the instructions for where the manufacturer wants the pads to be placed. So using this particular one, the picture says to put it above the nipple and over the chest wall, but you notice I'm going to be placing this over an existing electrode. You never want to place a pad over an existing electrode because it will burn the patient underneath. So what we're going to do is take this electrode off, and we will replace it with this pad. If we keep the patient on the existing telepack, we will need to move this pad. So we're going to imagine that the patient's arm or shoulder comes out here, and I'm just going to place it here so you know you can continue to monitor there. The second pad, again, follow your manufacturer's guidelines. This one goes on the side and is attached. Okay, I left them loose. So what you also need to do is connect this to the monitor. The monitor will save the patient's life, the pads, not the electrodes. So typically, your monitors, now this Medtronic one is usually attached to a shock block similar to this. What you need to know is you need to connect the pads here to the monitor. But the monitor is always on a shock block because we do daily checks. So what you do is grab the shock block here, pull it apart. And sometimes it's very hard to pull apart. The next thing you need, I need to put my glasses on for this, is you look on the wire leading from the monitor, and there is an arrow here. Okay? in an emergency, you can never find this, so I cannot more strongly recommend you take the time to try to do this in advance. You also have an arrow, very faint, on the pads that are attached to the patient. So, in a crisis, don't panic. Take the shock block off. Oftentimes, I've seen nurses trying to connect the pads to the block. The block will not save the patient's life. Look for the black arrow. Look for the arrow on the pad, which probably is difficult to see. Push them together and lock them in. Okay? So, I will again ask my handy cameraman to come in. Can you come in and... So you're looking for the two arrows using this Medtronic system, and you're pushing them together and locking them in. And now you're ready to either Cardiovert, shock, or pace the patient.